I was wondering if you could take us through the different kinds of masks that are available to everyday Canadians.
Yeah, so practically people should be wearing cloth masks because they're easy to make, they're easy to buy. So that's the most common one. And then people can use medical masks, so more of those paper ones. Those were in short supply for a long time. The supply seems to be okay now, so you can also use those. A lot of stores are handing those out. Increasingly, stores won't let you in without a mask. If you don't have one, they give you one of these paper ones. But they have a short shelf life. If they get wet, they're not of use. And then there's becoming much more popular is shields. So plastic shields that you wear over your face. A big advantage of those is people who have hearing problems. You can see their lips. They're a little more comfortable, but in both cases, really important that you wear them properly. Whether you wear a mask or a shield, you have to wear it properly. It has to cover your mouth, your nose, anything where the virus can enter. The one to be avoided actually is you'll see some with a little plastic tube in them. Those are good if you're doing woodworking and you don't want to breathe in sawdust, but they're actually not good for COVID because they have places where you can breathe out. So you breathe out unfiltered air. So it kind of defeats the purpose of the mask. A mask is essentially to protect others, not to protect the wearer. It gives some benefit to the wearer, but mostly to others.
So how reusable are they, homemade masks?
Well, that's the benefit. You just wash them. You should have a few. You should wash them. Anytime they get damp, you should change them. People forget that. If you're out for the day, you should have several masks. Once they get damp, they, one, get uncomfortable, and two, less useful. So have a bunch, wash them with your regular wash. You don't have to do anything special, but try and avoid handling them. So the technical term is donning and doffing. So putting it on and off. Be careful that you don't, the germs that you've collected, that you just don't bring them home and put them on your hands and then put your hands in your mouth. So again, that would defeat the purpose of the mask.
A reader was asking whether people should be wearing masks if they are planning to attend one of the Black Lives Matter protests.
Probably just to be safe. Now, the good thing is the protests are outdoors. There's less risk of spread outdoors. There's fresh air, there's wind, etc. People are moving. You know, the greatest risk is when you're stationary in a place with other people in a closed space. So the more open the space, the more movement, the greater the environmental, perturbances around wind, etc. All that stuff is good for not getting sick. So, but it depends how big a march is, how close you are together, if you're going to stand there for a while. But I think most protesters, from what I can see on TV, are being quite responsible and erring on the side of wearing a mask. The really important one is if you're sick in any way, just don't go out. That's not worth going to the protest. You know, there's all kinds of debates about, is there going to be a big upsurge after the protests? What's the trade-off between, civil liberties and making a statement and putting people at risk? And I think these are complex societal issues, but I wrote a column on this saying, I think we have to respect the right of people to protest and hope that they'll be as responsible as possible. But I don't think you can reasonably say don't protest because of coronavirus for something so important. And as I noted in my column, racism is also a public health issue as much as this virus.
Senior residents in long-term care homes across the country have been in full lockdown mode since March. Residents are holed up in their rooms with no visits from friends or family and no end in sight. When will it be safe to open up these facilities to visitors?
Well, I'd answer in two ways. I don't think we're ready for visitors, but I think we're long overdue to have caregivers. Family caregivers are really essential caregivers. So we have to stop calling them visitors, and they should have been in there a long time ago. Yes, there's a risk to them. There's a risk that they carry the illness out, but it's outweighed by the needs of the people, especially, I've heard so many sad stories about patients with dementia. They haven't seen a loved one, 80 days. There's someone who follows me on Twitter who each day gives me the daily update, 80 days, 81 days without having seen my father. And it's really unconscionable at this. So some provinces are allowing it, finally. Quebec allows it. Ironically, Quebec has the worst number of cases in long-term care, but they've recognized that this is really essential. They're as important as the PSWs, as the nurses, the family caregivers, so you have to give them that right to come back.
We're going to pivot now. We're going to talk about testing next. Obviously, there's different types of tests out there. You can be tested to see if you have COVID. You can also be tested to see if you have the antibodies for this novel coronavirus. But I thought we could start off by getting a sense from you about where Canada's at in its testing for COVID-19 levels.
Yeah, so we are still telling people if you have symptoms, if you think you're sick, if you think you've been in contact with someone that's sick, we're testing high-risk groups, people in nursing homes, medical workers, if you're increasingly in factories, farm workers. So we're testing those high-risk areas. Canada's doing a lot of testing per capita compared to the world, but we have our difficulties. Ontario, we keep writing about Ontario struggling with testing, but it's not struggling with the test itself, it's struggling with the follow-up. So every time you test someone, you have to do contact tracing. You have to figure out people they've been in touch with, get in contact with them, and get them tested. So these processes are long, and their contradictions are doing them much better than others, if I can say that in a polite way.
Let's take a minute to talk about how accurate these antibody tests are. We're about 2 months into when they started to be rolled out. Are they any better?
Well, and Canada's being cautious on this. We're trying to figure out, that's what's going on now, trying to figure out which ones work best, how accurate they are. The US, a month ago, 6 weeks ago, really just approved everything. Just said, yeah, let's go, it's important. And that's not worked out well. There's been some disasters. There were some large scale. There's a case written about quite often in Colorado where they did thousands of antibody tests, decided, you've been infected, you're safe here. And it turned out the test was not accurate at all. So it was actually counterproductive because their infection rate went up because all these people thought they were immune to further infection, and they weren't, and they went out and got infected. So I think it's important that we take time to figure out the right tests. I know that's frustrating. And the other really important thing is an antibody, right? So this isn't a simple thing. You have to figure out which antibodies, which ones give you immunity, how long will the immunity last? We're pretty sure there'll be immunity, but how long will it last? Will it be 100%? If you get a measles vaccine as a child, you're protected for life. But those are the low-hanging fruit. Those are great. Many viruses are not that. You just get immunity for a short time. We get colds over and over again, so we don't have immunity. Many of the colds we get are actually just other coronaviruses, not as lethal as this one, but it kind of gives us an indication that we may be able to get reinfected.
The WHO has said this virus may never go away. There may not even be a vaccine. It's not guaranteed that there's a vaccine. And this viewer is wondering what your advice is on how to cope with what is essentially a new chapter in everybody's lives.
I think we have to remember that, yeah, it is possible it'll be here forever, but eventually we'll all get exposed in some way and have some sort of immunity. There's many diseases out there. There are hundreds of infectious viruses, bacteria, protozoa, there are all kinds of risks, and we've learned to live with them. We don't freak out about them all the time. So this is new, it's scary, but we're going to adapt to it, and it's going to be part of our new normal. So I think that the next year, 18 months are going to be hard. We're going to have to figure out how to do this, and whether there's a vaccine or not, I think we're going to figure this out. Humans are very resilient. We're very, we innovate, and we're going to live with this.